You guys can hear me better? Okay.
All right, go ahead.
Good morning. I'll call the Crow Wing County Personnel Committee for October 19th, 2020 to order. We have Commissioner Brecken, Commissioner Hoag, Commissioner Barrows in the room, and Commissioner Coring has joined us by teams. And with that, I will turn it over to Mel for the staffing report.
Good morning, Chairman Barrows and commissioners, and Paul. Good morning to you on Teams. I'm glad that you're able to make it. This morning we do have a relatively short update on the agenda, but I did want you to know at 9:15 I do have our Community Services Director as well as our Public Health Supervisor coming to give you an update. I thought this was a good forum to do that, just to give you an overall up-to-date information on how COVID-19 has impacted the county. So just know that that's going to be happening about 9:15. They may be waiting out in the hallway for us to summon them in. So I may get up and grab them as well. So what I'll do on the agenda is I'll go through our personnel actions item with just a quick staff update and primarily on COVID-19, and then I'll go through our personnel actions. And personnel actions are relatively short, so that should take maybe about a half a second. So, good morning, Kara. So first off, just with our staff updates related to COVID-19, and again, Kara, Terry, and Michelle Moritz will give you an overall broad perspective of what's happening in the county. But our current cases related to COVID-19, just with our employee population, this was updated as of Friday late afternoon. I just had a situation come up early this morning when I got here, which is not included in that. But we have had 8 employees that have tested positive for COVID. Fortunately, they have been in areas that work from home has been the ideal situation to help mitigate some of those, exposure to other employees. So Carol will touch on that probably as well. And then we have had approximately 17 employees that have been quarantined because of themselves being exposed to somebody, waiting a test result, or they have had a family member or somebody else in their household that was exposed to COVID-19 and tested positive. So that was 17. Each day that number may climb as, the COVID and the coronavirus becomes more prevalent in our households as well as in our community. So, and then as you recall earlier this year, the federal government launched FFCRA, or the Federal CARES Act, to help employees with emergency sick pay as well as pay if they had to do distance learning for their children. And we've currently have had 4 employees take advantage of working 2/3 of the time from home to help care for their children while they're doing distance learning, or if their daycares were closed. And then just the total FFCRA hours, this includes emergency sick pay, the 2/3 safe learning hours. As of the last payroll, we use 751.50 hours. That equates to approximately $17,895 that our employees, that benefit that our employees have been given. That is also something that is CARES Act reimbursable. So just know that that'll be Nick, our finance director, will work through that reimbursement. So the positive case count has been primarily in our community services area. They're our largest work group that we have here in the county with a little over, gosh, I think almost 190 employees. Kara, if you can correct me later. And then we've had one employee in our highway department that had contracted COVID, had already been working from home for a significant amount of time. So there was no additional exposure there. And then we've had also 3 people that have had to take FMLA, or that were quarantined prior to them taking standard FMLA leave for a elected surgery or a surgery that they had to do. So there's all kinds of unique cases that come up. Every day is sort of a unique day when it comes to helping an employee through a COVID-related matter. But there's a lot of strategies that the county has put in place, and as you are aware, some of the safety measures, the PPE, extra things that we've done. But I think some of the unique things for our county, and maybe I think a lot of other counties have really used us as a model, is the strategy of working from home has been ideal to be able to deliver great customer service, but yet work from home and sort of mitigate some of the exposure to COVID. Flexible hours. I think we do a really good job with flexing hours to meet the needs of our customers and to maintain that workforce. An example of that is in our sheriff's office, that they have done that as to ensure that they have their deputies protected. Shift lengths, adjusting people's shift lengths has been ideal as well. I think something kind of unique that we hit the ground running on with our IT team was that virtual meeting and limiting in-person meetings here at the county. And that virtual meetings, the use of Microsoft Teams has been just ideal for us here. And of course, we're doing social distancing, wearing masks, and having a really strong mask strategy. Proper hand washing still becomes, one of the major expectations that we would expect all of our employees to do. Did you have a question, Steve?
Nope.
No? Okay. And then just communications to staff. We are continually really communicating to our staff on all of the expectations that are necessary to ensure that COVID-19 doesn't spread rampantly. It's going to come. It already is here. I think there's only 3 counties in the whole of the United States. One is in Alaska that there isn't a COVID case yet, and that's a lot. There's only 3 counties in the whole U.S. I think one is in Alaska, one is in Texas, and I can't remember the other county, but incredible. We do a lot of checking in with our staff as well to ensure that they're okay. Do they have any concerns? What do they need? I think it's that constant communication. And then just our partnership with each department, whether it's on the cleaning strategy that we have, or maybe we need, like in our jail operations, we have had to really scale back on some of those extra projects to ensure that our jail staff is protected, as well as that inmate population. And so I just wanted to give you some of the strategies that the county has been doing to help mitigate some of those concerns of COVID.
Mr. Chair, if I can ask a question. Mel, with this actions you've been taking, working from home and that, what's HR going to be looking at in the future when it comes to the future of working remotely?
Yeah, I think that's going to be part of our workday strategy here. I think it'll, our community services certainly has been a model for for our county in terms of how they're able to really strategize to ensure that the customer is taken care of. I think that we're going to see some of that just in general in the United States as well as in Minnesota. There are many counties that are just continuing on to do work from home going forward. They don't feel that there's a need for people to necessarily be in the office if they can meet that need of the customer. So I think that we're going to see some of that as well as we plan forward. So, Tim, I don't know if you have any thoughts on that or any other comments?
No, I think it is going to have an impact, and as we move forward, and different generations, I think, are going to have a different perspective on that
Yes.
as well. My kids are going to think very, very differently about that than my generation does. The older generation, it's more easy to, you know, the way we've made sure people were working is by looking at them. And I'm not sure that was ever really a particularly effective method, by the way. If we could see you, we presumed you were working. I think it would be better for us to establish what is the measures of near and far of when people are working, that they have achieved what we asked them to achieve. And so we measure a great many more things today. And we look at the numbers instead of looking at the body. And if the numbers are there, then we tend to care less where you accomplish the work and when you accomplish the work. I think we're going to see a real generational shift, and I'll bet you 50 years into the future, I wonder about institutional settings. How often will people expect you to come in to a particular physical location for services? These buildings are very expensive. And so think about the infrastructure costs and the differences that that has for institutions moving forward. I think there's a lower cost structure in some of this as well.
It'll be interesting in the future also with the union contracts that are there and the hours of work that are involved in those, or part of that contract, and how we change that as we look at the different way of doing business.
Clearly written by people from my generation.
Yeah. All right, any other questions that you might have? No? All right. Let's move on before Kara and Michelle Moritz join us. Just the HR personnel actions, it's relatively short. We've had 3 hires that have one person started on the 14th, replacing a front desk person over in our community services area. And then we've also did find a replacement for one of our IT help desk people that relocated to the Twin Cities. So those positions, one person started on the 14th, and then one will start on the 26th. And then we did have in our land services department, we did have a promotion of one of our internal promotion of one of our employees, Sandra Bruland. You may know her by Sandra Eric, who recently got married, but she was promoted to the assessing services supervisor position. And that was effective on 10/19, or today. So that is it for personnel actions. Any questions on that? All of these were part of the 2020 budget.
Mr. Chair, our staffing levels right now are, I'll say, adequate, or where they should be?
Most definitely. We don't have hardly any openings. We have an opening for a records position. We do have a hiring list for our deputies. We are getting down to the final stages of filling our sheriff's office lieutenant position for our dispatch area. We have 2 final candidates. And that should hopefully come to fruition this week. So we'll be able to talk a little bit more about that in next personnel actions. They're still in the backgrounding process.
Okay.
Okay. That's it for me. Don't have any other questions.
The shortest list we've seen in a long time.
I know it is, isn't it? We've been busy down in HR. Just a couple other reminders, since I just looked at my notes. If you are needing a flu shot, or our employees are needing a flu shot, we still have flu shots running from October 20th as well as October 28th down in meeting rooms 1 and 2. As you recall, we partnered with Guide Point Pharmacy that is administering all of our flu shots. So we've gone through our highway department. We had about 21 or 22 people get flu shots last week, and then our jail and sheriff's office community got them last week as well. And then if you haven't completed your open enrollment, if you have benefits with us, we certainly would like to help you through that. I can't remember where we're at today. Amy was just updating our numbers, but we're a little over halfway for open enrollment for benefits. And this was a really unique year that we were able to get a 0% renewal, which is probably unheard of when I think the average in the state is about a 4% increase. So working hard to get that for our employees was really important. And we thank you guys for all your help with that as well. So,
Very good.
okay. All right,
Thank you.
Kara.
Good morning, ladies.
Good morning.
Morning.
Good morning, Commissioners. Michelle Moritz, Public Health Supervisor, coming to you with an update of our COVID case study, or case counts and status here in Crow Wing County. The numbers are ever changing, so I could pull them again 5 minutes from now and they'll be different than even what I had sent over this morning. But this morning we're looking at 880 cases, which is a substantial gain from last week. For a couple weeks, we were having about 100 new cases a week. This week, it's looking like 150 between. So we're rapidly climbing here. Age ranges have maintained about the same. It's covering all ages. However, our little ones are doing a great job of not contracting the virus as rapidly as our other age groups, but we did have a 9-month-old, and we also had all the way up to 103 that had contracted the virus. Still, females are leading the males in cases, and that could just be with who's going in and getting tested, as well as who's in our medical fields and in our long-term care facilities that might be getting exposed as well. Symptoms. Although we do have a good number of people that have reported that they don't or didn't have symptoms at the time of testing, still the majority are having symptoms. And it could just be that at the time that they were testing and at the time that we were interviewing them, they may not have had symptoms. Commonly, these ones are employees that are getting tested because of routine testing at their workplace, but also individuals that are going in to have surgery. They're all being required to have a test prior to surgery. And so that's where we're catching quite a few of those asymptomatic tests. Underlying health conditions. This was a figure here that surprised me. The vast majority do not report that they have any underlying health conditions. However, they did still contract the virus. The good news with this is every day we add people to the list of no longer in isolation and past their point of being a positive case and are no longer in isolation. So we're looking at 600 plus cases that are beyond that out of the 880. However, the gap between that first table there, the COVID case status, you can see the gap between the number of people that are past their isolation and the current number of positives. That is expanding. That blue area is the ones that are currently infectious in comparison to the individuals that are past their quarantine phase or their isolation phase. Hospitalizations, that was something that we noticed a couple of weeks ago, that was on the rise. That's that second table there. Early October, late September, we saw those numbers start to climb, and today we're sitting at 47 individuals have been hospitalized.
Quick question for you,
Yes.
Michelle, on that. Do they separate, some go into hospital but not into ICU, some need respirators, some don't? Of that 47, is that broken down into those categories?
They were tracking that, and it seems as if they're tracking it a little less than what they have. I know they have deeper dive into numbers, but not so much per county level.
Okay.
They've changed their reporting criteria and how they report it back to us. It constantly is changing throughout this. Yeah.
Okay.
Michelle, 2 questions.
Yes.
We have 880 positive cases, and we have 667 are no longer in isolation or beyond the period for isolation, which means 213 of them still are, correct?
Well, and part of the problem, these numbers aren't perfect.
Right,
Because
but approximately.
Yeah, because we don't get this information about everybody. This is just of those that we've been able to interview.
Okay.
That we have the numbers. So if you added up, the only numbers that are pretty perfect is the male, female, because that comes directly from the lab. But then this, if they have symptoms or no symptoms, that's when we're interviewing them, as well as like the underlying health conditions or no underlying health conditions. Those pieces we only get that information if an interview is conducted. So that's our contact investigation, contact tracing, that the numbers are not perfect because we do have well over 100 cases that we haven't talked to at this point, either that they were just added to our queue for calling, or they were unable to be reached, or they refused the interview. So numbers will not be perfect in that area.
So here's my question about it.
Yep.
47 individuals hospitalized, 213 that are unaccounted for in terms of hospitalizations. What should we make? What conclusions should we draw about the rate of hospitalizations for those who end up being symptomatic or get a positive result?
I have not ran the numbers that direction as far as hospitalization rates to the individuals that have tested positive.
Okay. And it gets to the second question, which is 47 individuals in our community are currently hospitalized. What's our capacity?
So this is over time, so 47 since the beginning of
Okay, so that's not a
time.
reflection of currently hospitalized?
No, this is
Okay.
over the entire, since March.
Do you have any sense of whether or not we should be concerned about rising rates of hospitalization and bed utilization? And, you know, we talked about that early on, how many ICU beds we had, how many ventilators. Is there cause for concern about that?
Well, I believe our hospitals and our regional coalition, healthcare coalition, has definitely looked at that, where they have designated different hospitals to be the COVID hospitals, where they can surge up their capacity. Other things that they have already put into place, like early on, was stopping the elective surgeries, so then they would have bed capacity there, moving people quickly in and out of the hospital as far as if they have minor concerns, but even just reducing those surgeries in general will free up a lot of beds. But our hospitals have been working on this, I would say 16 years that we've worked on surge capacity around pandemics. I believe that they're very prepared for that, but also the state in general. They have set up hospitals, makeshift hospitals for individuals that would need hospital level care, but could be seen outside of the hospital and not necessarily for COVID, so for other needs as well.
So please give us early warning if you see that we're starting to approach
Yes.
that point, or even you can see down the line that we're going to approach that point. 'Cause
Absolutely.
That's
And
a huge deal in our community. And I'm glad to hear right now it's not a challenge. That's what I'm hearing.
Yep.
Today, it's not a challenge. But it could be if these case numbers keep rising. And so in my mind, that's a bad bellwether if you're starting to
Absolutely.
approach that. So
And that's one of the stats that the state is looking at across. They have different dashboards that look at hospital capacity for all across the region and across the state. It's pretty robust.
I don't see that, which is fine.
Yep.
I don't need to. I'm just asking, if you see some concern on the horizon for here, please tell us early.
Absolutely.
Mr. Chair. But if we do look at this chart for hospitalizations, it is on a rise of the number of people requiring hospitalizations, but we just don't know what that number is today. I mean, with this chart, we could probably
Right.
get fairly close, but
Today, I believe it's around 4 or 5 individuals.
Oh,
We
okay,
have
so-
individuals in hospitals, well, actually, 1, 2, 3, like 6 different hospitals that we've had people go from Crow Wing County to their location, so it's sometimes outside of our community, but we're watching this as well, because we've had everywhere from 35 years old up to 95 years old needing hospitalizations. Certainly, if we start seeing more cases in that lower age range, that would absolutely cause alarm. The 35 caused alarm. But the majority of these cases that have been hospitalized is another area that people typically ask about is where did they come from? Did they come from long-term care? And so far, overall, our cases have been the majority from private residents. So they weren't coming from a long-term care facility to the hospital to be treated. It was people out in the community that needed hospitalization. That's concerning. That's concerning. But I know that the hospital care is there when people need it, and that they are taking the measures needed to make sure that life is preserved and that we're taking as much precautions as we can and treating people well, giving them the care that they need. It's there.
So Michelle, across the country, it's not tracking the same way. I mean, Texas might track these cases differently than Minnesota. So when our snowbirds head south and we get into these colder months and we don't know if they're traveling back and forth or how, or people, you know, some child might, or not child, but an adult child, would travel to have Christmas with their parents in Texas,
Yeah.
who are snowbirds, and then they come back. We don't know how that's being tracked. Would that be correct? So these numbers, again, are going to be even more skewed perhaps in the winter months.
It could be. When we do the contact investigations, we're asking about where have they been over the last 14 days, where are they currently staying. So it's not uncommon that we get cases that have a Crow Wing County residence, but they're really in Texas or Arizona. Then those cases, if they contracted it there, the numbers are going there. So then it's not counted towards Crow Wing County. But also, are they doing the interviewing? Each state is different. Each state is different. Some are doing the interviewing, some are not.
Okay. And that's a concern too. It's just not being followed in some areas.
Deaths overall, this is a total cumulative number, 21. And I know, Chair, that you had asked last time how many of those individuals were hospitalized. That has increased to 8. I believe last time it was 3. Then the chart below, suspected exposure settings. The majority of cases, they are reporting that they know that they had been in contact with somebody that was positive. So this is where that we take the positive case and we contact everybody around them, or the individual contacts the people around that were in close contact, and close contact is 15 minutes or more, 6 feet or less, and then we would let them know, or the individual would let them know that they were exposed to COVID, and that we then start that 14 days that we recommend from the last contact, that they start monitoring for symptoms, stay home, social distance, and then at days 5 through 7, we recommend testing. So we're finding that that big chunk, the green chunk there, known contacts to a positive case are testing positive. So that is the area we're having the highest gain in cases out of all of the different exposure settings. Behind that is the community unknown. They don't know where they got it from. And then also our congregate care settings. And with that, keep in mind, they're testing these individuals in congregate care and the employees every 7 days, working towards a safe environment for individuals to live, and then with hopes to start having visitations with their families and friends. I know this is a big concern for a lot of our families, keeping our loved ones safe in long-term care facilities, but also the risk of isolation and depression. It's a lot of different mixed challenges there. The second page there, COVID cases by age. We continue to have high numbers in that 19 to 29, but fairly steadily, the other age ranges have also followed suit with increases. With this also, you can see beginning of September, we had a marked jump of going up in cases here to the beginning of October. And it's not just in the 19 to 20-year-olds, it's across all ages. Testing. I feel very fortunate here in Crow Wing County that we have strong healthcare practices and that both of our healthcare systems have also lined up easier access to testing. So far, we have tested over 18,000 people, and that may be that some people have tested more than one time. I certainly know of some that have tested repeatedly, like the long-term care facilities, but of those, this was numbers from earlier, or Friday, that we had 18 plus thousand that had tested, and then only of those 766 had tested positive at that point. So we've had a nice gain of tests, and then with that, our long-term care facilities having access to a National Guard coming in to do testing, but as well as different teams from across the region that have helped with doing those tests. Our medical centers, Cuyuna and Essentia, have a variety of availability for people to access testing when they want. And then also, we had a community clinic in Aiken last week, the 13th through the 15th, where 557 individuals attended. I have heard rumblings of another community clinic being offered in Little Falls, October 27th through 28th. I don't see that posted out yet on MDH's website on how one would register, but as soon as we have that information, we'll certainly be sharing that out across the county. Other options, there has been a couple of new clinics set up for the saliva tests. Duluth was initially one of the first ones to be set up, and then now we have Winona, Moorhead, and Brooklyn Park. Part of this is Minnesota Department of Health is expanding their lab capacity, and there's a new lab that is being set up in the Twin Cities where it's actually going to be a really nice option where individuals can get a test, mail it in, and then have their test results sent back to them very rapidly. So a mail-in system, and some of our staff were able to test that out. Minnesota Department of Health did give us that opportunity to give them feedback on these test kits, and so yes, it has been interesting, and the key is just follow the directions.
So Michelle, how long is it taking to get test results back?
The good news with that, we're seeing about a 2-day. It's actually decreased. I know the last time that I reported it was 2.5 days. We're down closer to 2.
And I can speak to the saliva testing, so I got to practice and try it out. I ordered the test, received it within a day.
Yeah.
Tested on Friday. You log into a link that you're sent. You talk with this nurse who's on your computer screen. She watches you while you spit into the tube. It's really exciting TV. And then you have to hold it up, measure it, mix it, and then you pop it in an envelope, one box in an envelope, take it to UPS. I dropped mine off Friday and got my results on Sunday. I was negative, which was also good to know because I recently traveled to California, and so that test came back negative within that 7-day time frame. So super easy and super quick results.
So there's options where if you request it by 3 o'clock, the test kit, you'll have it by the next day. This is if you go online and request it. They are giving us some options to be able to purchase some of these and have available where we could just hand them out and then they go through the process. Options, and of course, looking at what other options might be to our community. Do we want to have one of these community events? Will they be setting up one of these sites in our region here in Central Region for the community testing as well? Where that is, these ones are open, I believe, 7 days a week where someone could go directly in and be tested. So in communication with the state on these options and exploring what is best for Crow Wing County. The schools The schools have been working very, very hard to keep our kids in school, and they have been a great partner. They are definitely feeling the pains of individuals testing positive, exposures, and working with each of the school districts, looking at the information of the data around their communities. Last week, or the week before, when I provided them information on their community, it was very different from one community to the other. One really had no outbreaks, very few cases of kids in their schools, and then the next, or to the far extreme, where another school district is dealing with many staff out. It's, unfortunately, it's going to be a matter of time with having enough teachers to be able to have our kids in school, or the staff available to be able to keep our kids in school. The kids are doing great. Very, very few cases being spread amongst the kids. So that is the good news with COVID. If there is any good news, the kids are not good at spreading it. This is a first. The Safe Learning Plan looks at the 14-day case count. That's new cases that occur in that 14-day period.
I want to back up, because
Yeah.
I'm just mulling what I just heard you say. And you're saying that kids are not spreading it. When I look at your case counts, however, by age, a third of the cases are in 29 and under.
So I'm referring to like the 0 to 10. They are
Oh.
not spreading it very well. Where we do see in the 0 to 18 tends to be towards the higher end,
Okay.
16, 17, 18-year-olds. But absolutely
So
19.
elementary is less
Elementary is.
likely.
Yep, it is very low numbers.
And that's actually a good thing, because it's probably most important for them to be in person in school, of all the age groups. I mean, I think it'd be better if everybody's in school. I think we know that. But of the ones that is most critical, probably it's elementary.
Well, and they're the hardest to corral, right? You've got
Right.
those kids running around
Yeah,
and
yeah.
not washing their hands, so it's pretty impressive that they're
Okay,
low.
I'm sorry. I understand better. Thank you.
The teachers are working very, very hard, and our school administration as well, to keep the kids in school. So the Safe Learning Plan looks at that 14-day count. This is not the only, this is not a hard, fast rule that if their count is between 30 to 49, that all the kids little kids would be in hybrid, and the secondary would be in distant learning, because if that was the case, that would be where we would be today, because we are looking at counts over 30. And one of the things I'm trying to give the school districts as much information weeks ahead of time before these numbers are being posted by the state, to see if there's any need to move to a different plan for having the kids in school. But this is just one piece. It's that outbreaks in their community. What is it looking like for staffing for their school? Has there been a major cluster? What are the ages really of the cases in their community? And each of the schools are operating to what their capacity is right now. And I know today was a shift for, I believe Crosby made a shift in their learning style for the secondary students, but the little ones, the elementary age, are in school. And outside of that, I believe Brainerd stayed at their current model and Pequot stayed at their current model. Any questions? Kind of, people ask, what's the next? What's next for us? The case investigation, case tracing continues to be a big time expenditure for public health, and we continue to work on those cases each day. I've got a wonderful team of staff that are making those calls and gathering as much information, and I know when they're doing that, they're not seeing the bigger picture of what's going on, but each and every one of those interviews are adding to the story and also adding to our learning experience from this on how we can guide workplaces and guide our community. The biggest thing still is the non-pharmacological interventions that we have been doing. that we need to stay with them. So that's the mask, the hand washing, cleaning, cover your cough, social distancing. If you're asked to quarantine, to please quarantine. And if you are positive, that you do take it serious and isolate from others to not have that next ring of people exposed. The social gatherings, all the restrictions that we've had with businesses, distance learning, closing schools, mask order, all of those things, they are not new to COVID. These are things that were in the plan, and case study after case study after case study that they looked at what were the best measures, what measures actually worked when it came to dealing with prior major exposures to infectious diseases, H1N1. This is not the first COVID that has circulated. Ebola is another example. That one is a really awful disease. But each of those different experiences that we've been through have made for research that I know will come after this. And you can see changes and differences in our case counts. When restrictions were lifted, we did see more cases. When kids went back to school, we saw more cases. That is expected, but we just ask that people continue to do the most that they can with staying home when they're sick. Stay away from people. That's been the biggest message, and the simplest message that I can give is we can see such a difference when people are not maintaining that social distance, and it matters. It matters a lot to all of our kids. It matters to our businesses.
Michelle?
Mr. Chair. Oh, I was just going to say, with the trend we're seeing over the last couple of weeks, and then moving into flu season, is there anything we should be thinking about preparing for or changing the ways we are operating today?
Well, one of the biggest things that I'm thrilled with is that we brought back flu shots for our staff. That has been something that I've been passionate about and having, because if you can prevent and take that illness out, then it makes it easier to see the COVID, because they do have very similar things as far as symptoms go. So if we can remove that, that was a really good move. That, and then all of the work that you're doing around distancing staff from each other with having them work from home, limiting the number of people in the building and the movement of people through our buildings. That is another great measure. Beyond that, I was searching last night just to try to see if any of the different plans and playbooks basically that we've had for pandemic planning that for the last, 16 years, it seems like that I've worked on this, just trying to find anything anything else that we haven't done. I'll keep looking, but it feels like we've implemented everything, and then we've started to ease it back. So what would be the next would be to go back to where we were.
Is there, in your expertise, what is a realistic vaccine date, or is that you can't believe anything you see or read on TV anymore? But is there some positive moves for a vaccine, I guess?
Nothing solid enough.
Yeah.
I guess at this point I gladly take vaccine, and that is one of the things that we are working on is vaccine plans. As far as the supply chain, we will guess and guess and guess until there's anything or something finally approved. But 3 of the different manufacturers we know started the different trials and have had to put them on pause. And I don't have anything solid, although it is something that we're absolutely planning for, because we will have it eventually. If it's April, May, June next year, that could very well be a while before we have vaccine. And so it's, delaying individuals getting sick until we have an intervention. So we have to use these non-pharmacological interventions before we have a vaccine, or until we have a vaccine, or until we have a medicine that we can give individuals that are sick. I don't know if you remember with H1N1, we actually had antivirals here in the county that we could give to people that were sick. This virus is not like that. Unfortunately, we don't have an antiviral to give. like we did back, I guess it would be over 10 years ago.
The therapeutics.
Commissioner, just speaking to some of the strategies, you know, we're meeting all of the time to talk about what this looks like for community services in the county at large. Something simple that we implemented now starting Monday is that all staff in community services with client-facing contact will wear a mask and a face shield. Just, you know, Michelle explains this best about the layering and how each layer provides additional protection, which is not 100%, but the more, the better. So we've started requiring that effective today. We talked on Friday about staffing levels and how Michelle's team is buried in the work and continues to be even more so with the number of cases rising. So how can we support her team and bring on additional staffing to help with the contact tracing and investigations? And so we're talking all of the time, and it changes all of the time. We're also looking at how do we lessen the face-to-face contact within community services. We had over 1,000 folks come through our doors in September. That is totally the opposite direction of the way we want to go. And so how do we work with our customers to reduce that and be able to serve them online as best we can, and getting out that message that that's how we need to serve you online, because we don't want to lock our doors. So yeah, it's constant strategizing about how we're going to deal with the pandemic ongoing.
You know, I'm concerned about, you know, businesses having to shut down. It looks like restaurants are pretty compliant. You know, if somebody gets in, they're voluntarily shutting down for a period of time. Are you finding compliance within the business community to help manage this?
Absolutely. Our business community has been wonderful reaching out to us, but also when we get permission from a positive case to reach out to the business, they have worked wonderful with us, and most times the business has already taken great measures to make sure that their staff are tested, and then also cleaning of their facilities too. We work with Minnesota Department of Health, and it's mostly Minnesota Department of Health that is following up with complaints. They're the ones that hold the licenses for like the food, beverage, and lodging locations, and so they're following up on that piece. We're following up on the positive cases and working with the businesses to recommend the testing and recommend who really needs to be out from work. And a lot of these places, it's quickly that they simply close down themselves because they don't have enough staff to maintain their services with a reduction of those that have been in close contact. So unfortunately, we are still seeing a number of businesses need to close for a period of time until they can get staff back and off of isolation or off of quarantine.
Okay.
Maybe to your earlier point about staff being overwhelmed, have we ever considered, you know, maybe, and I don't know if it's even doable, but like volunteer, like retired nurses or others that could come in and help do some of the tracing components of your work, or has that been considered, or maybe so it sounds like?
Absolutely.
Or have you done that?
So we have actually brought back a number of staff that have retired.
Okay.
Or have moved on to other positions. They have come back to help us, and then also we're looking to the next round of individuals that we will need. There's a considerable amount of training that goes into being able to do the contact tracing, and so making sure that an individual can give us enough time for the amount of time that is invested in training them, and wanting, you know, I expect a lot of them, and so doing good interviews, getting good information has helped us very quickly, you know, identify different clusters that otherwise wouldn't go noticed. And
Good.
yeah, absolutely. I'm looking to retired nurses as well as our former employees, and there's a lot of people that have a passion for public health, and it's great to have their support, and they have reached out, and people that have retired from our team in the past, and they're not going to miss the pandemic to help us. They're coming back to help us.
That's awesome.
Tim, did you have a question?
What can you tell us, Michelle, what do we know about the most common ways in which we're seeing community transmission?
Early in the summer, we were noticing more around the social gatherings such as weddings and funerals, birthday parties, or even just holiday celebrations. What we're learning from that is it spreads very easily when people are gathering together, even when they're gathering outside, and being attentive to those symptoms, but also remembering that you can spread it 2 days before you even notice that you have symptoms. So the community spreading, we're seeing a lot connected to social gatherings. I would say today, because unfortunately we're out of the summer season and into it looks like straight into winter, but I think we will continue to see more and more cases that are actually connected to workplaces. And there's plenty of businesses that are not like Crow Wing County where they do have people back in the office. And so we're seeing the spread amongst the coworkers, if it is when they're sitting down and having coffee together or in a meeting. Those are those social close contacts that we want to try to prevent, and so to continue to encourage our workplaces to maintain that social distancing.
Thank you.
Thank you.
Help me understand something, because I hear all the time that we're heading into the cold season and that creates problems. Yet we talk about isolating from one another, staying away from each other, and the cold season, to me, causes us to stay away from each other. There's fewer gatherings other than in your restaurants and bars and churches. So I don't quite get the rationale there that this is going to be a riskier time when in fact we will isolate more.
We tend in Minnesota to isolate, it seems as if, in the winter months. However, then your close contacts that are in your home perhaps or in your workplace, they're the same people that you're around day in and day out, 5 days a week or even 7 days a week, and it's easily spread amongst household contacts and workplace contacts. I thought you were headed to, is this virus susceptible to heat or cold? And thus far, we haven't seen that be a factor in the virus. It seems to not care what the weather is like. But our movements do change in the winter months, but that means then I'm spending more time with my children, where easily they could share it with me or I could share it with them, where in the summer months they're go, go, go. I think there's no good time, Steve.
Right.
Winter or summer, COVID does seem to spread as long as you're 6 feet away or less and spending time with individuals. You want to make sure that you're putting that distance between you.
So we should encourage people to get outside during the winter months.
Well,
You still want to go outside?
you still want fresh air, and of course our windows aren't necessarily open and doors open for getting the fresh air, but it is an added problem for Minnesota.
I don't want to forget Commissioner Coring. Do you have any questions, observations?
Can you hear me?
Yes.
No, I don't. It's good information, and I will say one thing about this Teams thing. I can hear better sitting here at home than I ever can sitting there at the meeting. So anyway, but interesting information. No, I don't really have any questions, Mr. Chair.
Thank you.
I just have two quick things. A shout out to our staff who've done amazing with rolling with our changes that we've had to implement and all of the things we've had to put into place to do work differently. They've been extremely flexible and understanding with all of that. But also a shout out to you guys for early on seeing the importance of working differently and in helping us to invest in technology to be able to deal with this pandemic. It was our early planning several years ago that led us to the place we are today, which has been extremely helpful in keeping our case count down and our employees and our customers safe. So thank you guys for trusting in us and seeing the importance of the way we're doing business as well.
Well, I think the numbers that Mel reported earlier about the staff indicates that everybody's doing a great job here. And so whatever practices, whether we had an involvement in it or whether it was from the leadership or from the employees themselves, everybody's done a great job of trying to stay as safe as they can, be flexible. For some people, that's tough. For others, it's the greatest thing since grapefruit, I guess. I'm not sure.
Fruit, no.
So everybody deserves a pat. You don't like grapefruit? Oh. What can I say? But I think everybody's done a wonderful job, and I do applaud everyone for that effort. And in Crow Wing County, I think we're very fortunate. I think that the businesses have stepped up for the most part, and I think that the people have stepped up quite well. And, you know, we've seen, in terms of tracking our sales tax and that, we've seen an increase, so we know that outsiders came in, and we handled it pretty well. We'll keep knocking on wood, though, for the coming months. So thank you very much for all you guys have done.
Thank you.
Thank you.
Anything else today? And with that, I think we're done. Thank you, Commissioner Coring.
Thank you.